Hello, my name is Jasmine Davis, and I will be presenting my presentation on systemic lupus erythematosus, also known as SLE. SLE is the most common, complex, and serious of the autoimmune disorders. There are several different types of lupus, but about 70% of people with lupus have SLE. SLE is marked by the production of large varieties of autoantibodies that attack self-antigens. The autoantibodies attack nucleic acids, phospholipids, erythrocytes, platelets, coagulation proteins, lymphocytes, and many other self-components. In SLE, the human body will break down many of these increased products with cell turnover. The product breakdown reacts with the circulating antigen, forming immune complexes that circulate in the bloodstream. These immune complexes invade the kidneys, causing severe kidney inflammation. These complexes may also tend to invade, or they do tend to invade, the heart, lungs, spleen, GI tract, skin, and the peritoneum. Type 2 and type 3 hypersensitivity reactions result because of this. Lupus occurs more often in women at a ratio of 9-to-1. 90% of the lupus patients are women, but men with lupus tend to have more damage earlier in the disease, and they tend to have lower survival rates. The most common ages for people with lupus are 20 to 40 years old. Researchers believe that hormones may have part in this, but studies haven't been conclusive with it yet. And actually, between 10 and 20% of people with SLE have been diagnosed before the age of 18. Blacks are also more affected compared to whites. Native American and black patients tend to have higher mortality rates than white patients as well. And Hispanic and Asian patients have a lower rate of lupus, or a lower risk of lupus. SLE, the cause of it is unknown, but a genetic predisposition exists with an increased risk in twins and those with a history of SLE. Experts also believe lupus may result from certain hormones, such as environmental triggers that may cause lupus symptoms to arise or exacerbate lupus symptoms. Here is a chart showing the pathological process of SLE, and symptoms begin when your immune system begins to weaken and stops working properly. Your immune system cells begin to attack normal healthy cells. This causes lupus flare-ups. The settling of circulating DNA or anti-DNA complexes in the kidneys is the cause of severe kidney inflammation. Similar occurrences may happen in the brain, heart, spleen, lung, GI tract, peritoneum, and the skin. Here I included some of the early and late symptoms of SLE. Arthritis occurs in 90% of individuals. A rash occurs in about 70 to 80% of individuals. With renal disease, lupus nephritis is the most serious renal complication with lupus. It causes scars to form in the kidneys, which impairs the kidney function, of course, and that tends to occur in 40 to 50% of individuals. Blood abnormalities occur in 50% of individuals with SLE, with anemia being the most common complication. Cardiovascular diseases such as myocarditis, endocarditis, and CAD tend to occur in 30 to 50% of individuals. Lupus can also speed up the formation of blood clots. In lupus patients who have the disease for more than 5 years, cardiovascular disease is the leading cause of death. Here are the expectant lab findings with SLE. Laboratory diagnosis is usually based on a positive ANA screening test, which about 98% of individuals will test positive for that test if they have SLE, but a great number of false positives occur in healthy individuals as well, and those with other diseases. So the ANA test is not 100% positive. The ANA test may come out as positive for years before clinical symptoms begin. So this helps a lot of doctors and patients with diagnosis of SLE. Once a positive ANA is obtained, follow with more specific tests. They may follow with more specific tests such as antibodies against Smith antigen and dsDNA. The goal of treatment is to control symptoms and prevent damage by suppressing the autoimmune response. NSAIDs may be used for inflammation and pain relief. Corticosteroids are used for more serious cases. Immunosuppressives can be used for severe symptoms that involve internal organs. Anti-malaria drugs may also be used for stable patients. And then anticoagulants such as aspirin, heparin, or warfarin. And here are my references. Thank you for watching my presentation.